Managing medications is probably one of the toughest things we do. It's been a very thorny issue for us. Talk to us a little bit about how you all use data to try to fill those gaps and make that list that the physicians see in the clinics as good as it can be.
We use additional data and we use AI to fill in those gaps. You remember being on paper, and I certainly recall the day that we transitioned into a modern EHR, there was a button in our EHR that would let me access what they called external medication history. And really that was a lot of claims data. Think about data that the patients, when they fill a prescription using insurance for et cetera, so PBM data, that was a godsend because on paper we had nothing except the interview and maybe big bags of pill bottles if we were extra lucky. And now we finally had access to something. You and I probably quickly realized that that data was sometimes incomplete. It was incomplete in two ways. One, there could be medications that were just flat out missing from that list. And that has to do with whether or not the pharmacy was participating in the data feed, et cetera, or how the patient did or did not use insurance. And then the second is the data or the medications, they could be missing pieces of the information, specifically the instructions. Because really, if you're looking at insurance claims data, all you're really going to get most of the time is the name of the drug and maybe the number of pills that went out the door. You still had to do a multi-faceted approach to getting the med history and the med rec correct. And that's still true to this day. But what Dr. First is able to do is take some of those traditional data sources, but also augment them with more data. And that data comes in the form of those 2 decades in the industry. We have connections to independent pharmacies or independent pharmacy software systems, as well as things like HIEs, as well as our own e-prescribing data. You can take traditional feeds and then augment it with all of this additional data. And then the new challenge, now that we're post-2020, is making sure that data is A, interoperable, meaning that your system can consume it. It's not just a bunch of blob free text. And 2, making sure that we're removing duplicative data or data that's old. I think as an internist, you and I have both seen like the Z-Pack that was from 4 years ago pop up on that list. And if someone's not paying attention, they're going to add that back to the med list. And you know what? Someone's going to add that to the admission orders, and then it's going to get transposed all the way down to discharge. And so this is that sort of pharmacy cascade that can happen if you don't get the lists correct up front. So really, Dr. First is doing 2 things. One, it's getting more data. We're hopeful that you don't have to make all of those phone calls to pharmacies, et cetera, to get additional data that you didn't have before. But we're also using AI to fill in the gaps, specifically for the instructions in that data.